The COVID-19 pandemic has accelerated changes in the way medicine is practiced, as medical care is increasingly begins with an online consultation rather than a face-to-face meeting. In Nigeria, digital health technology firm Clemac is helping to connect patients with doctors and pharmacies through its virtual medical services. I spoke to Chima Amadi, founder of Clement Digital Health and a former Mandela Washington Fellow, about their service. Welcome to Africa 54.
Thank you, Paul. Nice to be here.
You are leveraging technology to improve the health services in Nigeria. What is it that you do?
I run a health tech company called Clemac Digital Health. So we leverage on tech to improve access to healthcare for Nigerians. We leverage on services like telemedicine, e-pharmacy, prescription refills, and helping people who need emergency health services to have access to hospitals where they can have emergency health needs. So this issue really became very, very, very prominent during the COVID pandemic, due to the lockdowns and due to the shortage of healthcare workers in hospitals, and due to some pharmacies not being able to meet the growing demand of people flocking to the pharmacies. So we try to make the life of the average patient easy, improve their quality of life, save costs, and ensure they have adequate access to quality healthcare.
How easy is it for ordinary folks, ordinary people in Nigeria to use this kind of technology to help with their healthcare needs?
You know, in Africa, within the past 10 to 15 years, the awareness about technology has really been improving. For example, you talk about smartphone usage has increased, unlike what you had before, where people used like the analog phones like the Nokia and the basic Samsung. And of course, the tech industry in Nigeria and Kenya specifically has been growing rapidly. So, and then COVID has also made it more, people to be much more aware of what you can do, implications of healthcare. You know, people switched to Zoom, from in-person meetings to Zoom and Microsoft Teams and all of that. So that awareness has really been within the youths and of course the majority of the population. So it's not really so difficult for them to be aware, but the only challenge they're having because of the cost of internet, right? So especially those in rural communities who seems a little bit left out from the service. But what we are trying to do now is to create another system, more like a SMS shortcode system, to include them in the service.
You're a service provider, and for you to connect with those people, they need access to the internet, but the internet is very, very expensive. So what can you do in the interim to make sure that you tap into that market?
Basically, what would be a lot of advocacy, so that people, in terms of the government and the private sector, to help, because these are like basic social infrastructure. But in the meantime, I think that's where our new service we are talking about, the short code and the SMS system, because when that comes into play, you really don't have so much option about the internet and of course the power outage. You can send a simple text from your phone and you still have more access to these services.
How did you come up with this incredible idea?
I'll start with the challenge. Actually, I lost my dad due to poor access to healthcare when I was still a teenager.
I'm very sorry about that.
Yeah, so that was really what I felt. Okay, fine, you know, something should be done about this, because obviously if he had the access to internet he needed, he wouldn't be late.
There is a lot of competition when it comes to the healthcare sector in Nigeria. Everybody is going into this space because there is so much to be done in that space. How are you dealing with that competition?
For myself and my co-founder, we have so much experience in the Nigerian healthcare space. At least I've been in the healthcare space for the past 7 years. So going to 8 years now. So apart from that, the collaboration is key. So for example, the Mandela Washington Fellowship gave me an opportunity to collaborate with other fellows in different countries. You
recently won a prestigious grant from the Mandela Washington Fellowship. You are one of the few Africans selected to come and participate here in Washington, D.C. and across the United States. Tell us more about that.
It was really a fun experience, was really intriguing. Because this is my first time to the United States. I haven't been to the United States before. I got the opportunity to network with the Americans, understood the business model of a lot of Fortune 500 companies, got to meet with like minds, experience the US culture, the diversity in America, and some of the history in America, which I plan to take back home and, of course, make my organization much, much better. And, of course, to networking with my fellow Africans from different, Africa has up to 54 countries or more than, and to network with this group of people, because it's opened doors for future collaborations, future partnerships, and future impact globally.